through the supraorbital foramen we talked about for frontal bone, passes through the superior orbital fissure, and the first branch of the trigeminal nerve comes into the skull via the superior orbital fissure. Okay? If your upper jaw hurts or you have a pain here, that comes through this opening that we'll talk about on Monday, through the inferior orbital fissure, and it comes in via the foramen rotundum. So superior orbital fissure is for the first branch of trigeminal nerve. Foramen rotundum right behind it is for the second branch of the trigeminal nerve. Okay? Then from the lower jaw, the third branch of the trigeminal nerve comes into the skull via the foramen ovale. Okay? So we have optic canal, superior orbital fissure, behind that, the foramen rotundum, behind that and lateral, the foramen ovale, and then like an exclamation point to our exclamation mark, the foramen spinosum. And that's for the blood vessels whose grooves you see forming all along here that supply the lining of the skull and the covering of the brain, but not the brain itself. So we form this crescent. And if you kind of learn it in that sequence, and it says the shape, rotundum ovale, that will help you identify it as well. Okay?